Hi, my name is Shannon. I'm doing a brief explanation of common GI diagnosis, symptoms, key issues, missing components, and treatment ideas, and an explanation of why these problems occur and how they happen. So, this will be a very brief video. It's not going to be edited or cut up, just a quick, informative video. Um, about 6 or 7 years ago, I was diagnosed with um, IBS, SIBO. Um, uh, Further along the line, I was diagnosed with gastroenteritis, and then so all of these, most GI conditions, in my experience, my opinion. Again, I'm not a doctor, so always consult your doctor before assuming anything or pursuing any treatment plans. But in my opinion, most GI conditions, and honestly, most health ailments throughout any part of your body, are caused by inflammation. And specifically, GI is caused by an overgrowth of bad gut bacteria. That could be H. pylori. I'm not sure how you pronounce it. It could be E. coli. And a lot of the time, the treatment and the time it takes to recover and to get your bacteria levels back to normal and to get that inflammation down, it can take a long period of time. It can take, sometimes for a little small, like a stomach ache, it could take days or weeks. But for someone who's struggling with a chronic GI issue, it could take months, it could take more than a year, just depending on your treatment methods. So, usually, an overgrowth of a bad bacteria in the gut, which is causing inflammation. And then the symptoms that this causes are trouble absorbing your nutrients in the food you eat, trouble absorbing the fluids in the water, any type of liquids, even electrolyte drinks that you drink. Your gut is inflamed, it's struggling, and it has trouble absorbing these things. So even if you're eating a lot or drinking a lot, you might still find yourself having trouble with uncontrollable weight loss, um, nutritional deficiencies, electrolyte imbalances and deficiencies. And sometimes the route people have to go with when they have serious GI conditions is an IV route, getting IV fluids to replace those fluids that are not getting absorbed properly in your gut. Um, there is also an IV route for nutrition. It's called TPN. I was put on that back when I was diagnosed with SMA, which is superior mesenteric artery syndrome. That was about 5 years ago. What happened was my weight loss got so uncontrollable, and I got so low that actually my artery that supplies blood to a portion of my small intestine, that mesenteric artery is held up by a fatty pad, a pad of fat. So when I lost too much weight, that pad of fat also disintegrated. So that artery collapsed, and therefore that part of my intestine that it was supplying blood to folded in half like a garden hose. So whenever I drank anything or ate anything, it would go in my stomach, go into my small intestine, and it would not go through anymore. So then I eventually started um, vomiting uncontrollably. And then I was sent to the ER, and that's when I was diagnosed with SMA and had to go undergo emergency surgery to have a G tube and a J tube placed. The G tube was put in my stomach to drain my bile, because even if I don't eat or drink anything by mouth, your liver and your gallbladder puts bile into your stomach, and that has electrolytes and acids that help hydrate you and break down your food and helps your GI system absorb your nutrition. So, since that bile wasn't going through my intestine because it was clamped, they had to put a um, can't think of the word now. They had to put a tube in my stomach to drain that bile so I wouldn't vomit it up. And then they put a J tube in my intestine and it bypassed the clamp off. And then I took in tube feeding that way. And then I had to get my fluids intravenously through IV. So they put in a permanent IV port called a PICC line. It lasts for months and months. And so some other points I wanted to make was not only does your GI system have trouble absorbing the nutrition in the food that you're eating orally, it also uses a lot of electrolytes and nutrition to fight off the bacteria. So you're kind of getting a double whammy. Your system is not absorbing nutrition properly, and your system is also using more vitamins, minerals, and electrolytes than normal to fight off the inflammation and the bacterial infection. Some tips that I would suggest. I have had 2 flare-ups. The first time was when I went to the hospital and had those tubes placed. The second time was this past fall. Some tips I would highly suggest to try to help better manage it is to get yourself a good electrolyte solution to put in your water. I personally like this. It's called Highlight Hydration. I got it on Amazon. It's only about $20 and it lasts you at least 6 months. It's a good long supply. That's the best one I found. I avoid ones with sugar or a sugar substitute in it, and I avoid ones with a lot of salt because too much salt can also dehydrate you, especially when you get to a really bad state. You will notice when too much salt, it will affect you more harshly than a healthy person would. Your body can't recover as well. So I would recommend Highlight. That's the best one I've found. Another thing is learning what foods to avoid. When you have different bacterial overgrowths will cause different food intolerances. You need to figure out what foods work and don't work best with your body. But a lot of the main ones that are hard for your body to digest and will make your symptoms and your condition worse are alcohol, caffeine, sugar, animal protein. A lot of people struggle to digest and process meat. So getting your protein from plant or oatmeal or different sources like that is better for some people. Some people have to avoid gluten. So oatmeal is a really great option in my opinion for that. But there's different controversies about this, but my opinion is not all healthy foods are healthy for every person. I think, and I've done research on, your heritage and what crops and what plants and stuff are native to your native land, what your ancestors have ate, and what your body and your DNA is used to absorbing. So just because avocado has healthy fats and is healthy, it does a number on my gut. It does not work for me, and there's also other tropical fruits and vegetables that don't work for me even though they're healthy. I think it's because, and there's a lot of research on this, that your DNA in your body is used to what your ancestors from your homeland have ate. So for me personally, what works best, and I also highly advise cooking any vegetables you eat. What I eat best, me personally, is cooked oatmeal, blueberries, blackberries, raspberries, almost any kind of berry, cooked spinach, some cooked greens, a little bit of cooked kale, but too much seems to cause me problems, cooked celery. So I think just doing some trial and error and doing some research, you could find out what foods work best for your body. And if you find that meat gives you problems, I would avoid meat, and I would avoid any meat-based protein powders, or protein powders that have a lot of sugar. The meat and the protein thing, I don't necessarily think that diet is the best, because there's a lot of research out there that shows if you consume too much protein, you can develop some serious issues, heart issues, GI issues. So I know protein is a low carb, high protein. It's a big fad for people wanting to lose weight and gain muscle. But there are studies out there that show it's not necessarily the best for your body. And solely relying on meat or dairy to get your protein may not be the best protein source. But again, consult your doctor, consult a nutritionist, and listen to your body first and foremost. Also, making sure, I'm sorry, I'm rushing because I'm trying to make this video as short as possible. Making sure to try to get any vitamins that your body might be missing. For me, I like to take, and I take liquid vitamins, and I hold them under my tongue for about 15 minutes, and then I spit them out. Again, sometimes swallowing vitamins or swallowing liquid vitamins, they don't always get absorbed very well through your GI system because your GI is under distress and it's not functioning properly. So I think it's, I don't know what it's called, some kind of absorbance under the tongue. So if you hold your liquid vitamins under your tongue, they'll absorb through your little veins under your tongue, and they will absorb more efficiently that way. So I get all liquid vitamins. The ones I like to use, I have a liquid zinc, a liquid D3, just because of where I live. You know, most people in my state are vitamin D deficient. And I also have a liquid B12, which when I was in the hospital and a nursing home, you know, they did blood tests on me every day, and also take a liquid potassium. But the vitamins that I was most deficient in was number one, potassium, which is an electrolyte, and it's very important. B12 sometimes, zinc sometimes, and those were the main ones. So those are the main ones I take, and again, I like to let them absorb under my tongue, especially if I'm having a flare-up and things are not absorbing as well in my GI system. So I hope this was helpful. I am not a well-known subscriber at all, but I know that GI conditions are on the rise, and for the people suffering, I know it's awful. I've been through some awful stuff. I've been on death's doorstep quite a few times, and I've stayed there for long periods of time. And if I can help somebody with the stuff I've learned, or just at least make someone feel like they're not alone, I would like to. I'll try to make a couple more videos that have more detail about certain things like hydration, how to get proper hydration, weight loss, why it happens, and how to try to prevent it and try to stop it and try to gain weight, different foods, and what is easiest on the GI system, things like that. But I will be, I'm not a well-known YouTuber at all. But if anybody finds this video and anybody has any questions, please comment, please ask. I will keep an eye on this. I've suffered through this a lot. I am still trying to recover from it. I still don't quite know what my future holds, but I'm doing my best and I'm putting the information out there because I want to help other people not suffer as much. That's pretty much it. Because, you know, your quality of life it's very important. And life is very, very difficult when you're suffering a lot. So if you have any questions, please comment. I'll keep an eye on things and I'll answer your questions as best I can. If you have any questions that you would like me to make a video about and describe in detail or answer in detail, feel free to ask. Like I said, I'll keep an eye on everything. And to those of you struggling or suffering, I hope this video makes it to you. And I wish you the very best. And please reach out to me if there's any questions or anything I can do to help.